From Penn State Health, this is Ask Us Anything About Anxiety. I'm Scott Gilbert. Well, occasional anxiety, it's a normal part of life. We may experience it before taking a test or right before we get up to give that big presentation at work. But anxiety disorders are not temporary. And for people who have them, the feelings of anxiety they get can get worse over time and even interfere with basic daily activities. We're going to talk about anxiety today with one of our experts here at Penn State Health. It's Dr. Timothy Zeiger. He's a psychologist. Thanks so much for your time today. Let's start by talking about how you do distinguish what we might think of as normal everyday anxiety with something that is a little more associated with an actual disorder.
Sure. I think what distinguishes everyday anxiety from anxiety that turns into something that we would label disorder is how it impacts someone's day-to-day functioning and quality of life. For example, in very extreme cases, people can't leave the house. They can't do basic activities that they used to do without this overwhelming fear, such as going to the grocery store or driving somewhere that they drove maybe 100 times before.
So that's when you know that it's reached a point where you might need some help then. I want to talk a bit about the flip side, though, because I'm thinking of people like athletes and others who actually thrive under pressure, and the nerves or anxiety in particular situations can actually be a good thing.
Yeah, absolutely. Anxiety sometimes is a very positive thing and can help us to actually enhance our performance. So I think sometimes if we're a little bit too casual or too laid back before that big sporting competition or before that big exam, we're not going to be fully prepared to be able to perform at our highest level.
You're watching Ask Us Anything About Anxiety from Penn State Health, Milton S. Hershey Medical Center. I'm Scott Gilbert alongside Dr. Timothy Zeiger, and we welcome your questions in the comment field below this post. As we always say, whether you're watching this video live or on playback, we can track down some answers for you. So do feel free to add any questions you have about this important topic. I'd like to break down the various types of anxiety, starting with generalized anxiety disorder. What's that all about? What are some of the signs of that?
Yeah, generalized anxiety is just your kind of everyday anxiety. So that can be things like a fear of going to a movie, for fear of like criticism, or anxiety about a test or a performance.
Okay. How about panic disorder? What are some of the traits of that?
So that's people who have, it can be cued or uncued, so it can be triggered by specific things in the environment. So again, such as taking that exam or just kind of things out of the blue. So for these people, there can be physical symptoms such as, shakiness, shortness of breath. They can feel like they're entrapped. So those are often symptoms of panic disorder.
One situation that comes to my mind is even speaking on camera or giving presentations. Some people are fine in any other setting, but you put them in front of a camera, which you're doing great, by the way, but you put some people in front of a camera and they have what you could consider to be a very logical fear of doing that or speaking to large groups of people. Is that a common something to worry about if you have? Where someone may be prepared mentally to kind of get up there and perform, and once they get up there, they just kind of freeze, and they begin to experience a multitude of symptoms, cognitively, emotionally, behaviorally, and it can just kind of be overwhelming for them. And I mentioned phobias briefly. I want to delve into that a bit more because when we talk about anxiety, how does it factor in when we think about people who may be afraid of spiders or the number of 13 or heights?
Yeah, I think when we think of anxiety disorders, specific phobias are probably the most highly kind of publicized in the popular media. So like you were saying, fears of spiders, fears of heights, they're very, very common and something that we see on a regular basis.
Now, one type of anxiety we haven't touched on yet is social anxiety disorder. Can you tell us what that is?
Yeah, social anxiety disorder is, again, when we look at someone's quality of life or quality of interaction being impaired by their anxiety. So it's people who have difficulty kind of interfacing back and forth with other people for, fear of criticism or judgment, that's what that looks like.
You're watching Ask Us Anything About Anxiety from Penn State Health. This is Dr. Timothy Zeiger. He's a psychologist here. We're at the Northeast Drive location for Penn State Health, and we welcome your questions or comments wherever you are, whatever your question is. Feel free to pose those questions about anxiety, and we'll get you some answers here. And also, if you find this content valuable, as we hope you do, please do share it on your Facebook feed to help get this information out to even more people. I'm curious, Dr. Zeiger, as to whether there are certain risk factors, environmental, biological, genetic risk factors that can perhaps increase the chances somebody will suffer with anxiety.
Sure. I think if we break it down, we can look at it in three perspectives, biopsychosocial. So from a biological perspective, we know that there are chemicals in our brain, and if they're not regulated, or if they're not functioning at the proper level, that can create anxiety disorders. From an environmental perspective, again, things like spiders, heights, certain situations, they can be triggers for anxiety. And then thirdly, just looking at it from like a cognitive perspective, the way someone interprets a situation or their environment, the way they're kind of thinking about situations, that can also be a trigger for anxiety.
So just as there are different triggers, I'm sure there are different treatments. So walk us through some of the different options there and how you may arrive at each. For example, whether to take an approach that involves therapy or maybe medication is right for someone.
Sure. I'd say our practice here at Penn State is to, look at every individual, every case, individually, and kind of break it apart and really kind of try to understand it. I think a first line approach would be therapy, and then medication would be a second line intervention or a combination of both. Again, looking at how it's really impacting the person's quality of life and day-to-day functioning. So someone who's very impaired would probably benefit from both a medication and a therapy to help them kind of overcome their anxiety and get back to optimal functioning.
Probably no one-size-fits-all approach, obviously.
Unfortunately not. It's not like, you've got a bacterial infection or a viral infection and you go to your primary care doctor and they prescribe a 10-day treatment or no treatment at all. Anxiety and treatment of anxiety is very individualized.
And how much of a product of the fact that there are so many different types like we talked about? I mean, if somebody comes to you with panic disorder, perhaps a different course of treatment is in order from social anxiety.
Yes. So someone walking into the clinic for the first time, we're going to give them a very thorough assessment, do a very detailed history, family history. We're going to look at pretty much every aspect of their life, really to try to understand what's going on. And from that, discuss with them the best course of treatment. And
so let's go back a little bit to prevention, because are there steps that people can take? For example, eating well, exercising. We hear that there are many reasons to do that. Do those factor in here as well?
Very much. I think sleep is a very big component to just emotional health and well-being in general. Often we find that people who are sleep deprived, it really just intensifies their behavioral health condition, especially anxiety. So sleep hygiene is a very kind of critical component. Diet is also a critical component along with exercise.
And when we hear about diet, that means all the typical things we know about, eating a balanced diet and lots of leafy greens?
Yes, absolutely. We want to avoid things like caffeine, stimulants, chocolate, kind of anything like that could trigger kind of the nervous system and kind of activate it more, making the anxiety symptoms even more debilitating.
I was going to ask you about caffeine, because some people may feel like they need caffeine in order to function. I'd be lying if I didn't say I had a cup or 2 or 3 of coffee each day. On the flip side, there are also people who may feel like if they're anxious, alcohol or some substances like that are something to turn to calm their nerves. Is that a dangerous thing to consider?
Yes, it absolutely is. With caffeine, we just kind of educate people on cost kind of benefit, caffeine versus not using caffeine. Oftentimes, unfortunately, we see what we call kind of comorbidities between behavioral health issues such as anxiety and the use of substances like alcohol is a very big one. Something that kind of calms the nervous system. It's a depressant, and kind of once that effect wears off, the anxiety can really roar its ugly head and come back.
This is Ask Us Anything About Anxiety from Penn State Health. I'm Scott Gilbert. This is Dr. Timothy Zeiger. He's a psychologist, and he welcomes your questions. Just add them to the comment field of this video, whether you're watching it live or on playback, as so many people do, and we appreciate you watching today. I'd like to ask you a bit, Dr. Zeiger, about how anxiety is connected to some other disorders we hear about pretty commonly. For example, OCD, or obsessive-compulsive disorder.
Yes, absolutely. So if we think of anxiety disorders, so anxiety is what I would call the general umbrella, and then things like obsessive compulsive disorder, they fall under the umbrella, along with your phobias and some of the other anxieties that we've talked about.
So a lot of different ways it can go then. PTSD, does that fall in there, post-traumatic stress disorder?
It does, yes. That's under the umbrella of anxiety disorder.
You talked a little bit about this earlier, but can you tell me a bit more about how symptoms related to anxiety can actually manifest physically, some of the issues you see in your patients when they come in?
Sure. I think that's probably one of the things that symptoms that first kind of trigger someone to think that they might have an underlying issue with anxiety. So if we look at it developmentally, with our youngest patients, we see things like, stomach aches or headaches, or some of our older population, just kind of general fatigue and unexplained pains, and those are very common, kind of frequent physical symptoms that we see.
It's the mind-body connection. Do you think a lot of people may not realize just how much the mind and body are connected?
Yes, I see that every day in my practice. I say that thing on your shoulders controls the rest of your body, and they kind of stop and think for a second, and they're like, oh, yeah, you're right. So, again, that education piece is pretty important for people.
So again, people watching this video may have some questions. They may be thinking, okay, some of the symptoms I've experienced seem pretty average every day. Some others may be looking for that next step. They may be wanting to look into whether they might have a type of anxiety disorder. What advice can you give them?
Yeah, absolutely. I would say the first thing is not to hesitate or fear seeking out an evaluation or treatment. I think there's less of a stigma now, although it still exists, with behavioral health and people seeking treatment. But I think kind of first line intervention would be to talk to your child's pediatrician if we're talking about a pediatric patient, or if we're talking about an adult patient, with their primary care doctor, as they probably have a really good established kind of relationship with that person already, and that might help ease some of the angst about seeking treatment.
And should people want to contact the Outpatient Psychiatry Clinic here at Penn State Health, the number to call for that is 717-531-8338. Again, that's 717-531-8338 for the Outpatient Psychiatry Clinic here at Penn State Health. And we're going to put that number as part of the Facebook feed. Mike's doing that right now for you. So anything else as we wrap up here, Dr. Zeiger? Any parting advice or closing words here?
No, I would just say that I think the prevalence of anxiety disorders are very high, and don't fear seeking out treatment.
I'm glad you brought that up, because I read somewhere about 3 million Americans each year diagnosed, something along those lines.
Yes, the rates are very high. They might even be higher, as a lot of people don't seek out treatment, again, for kind of the fear behind it, or the stigma behind receiving treatment.
We're providing the resources with this video and the links we provide for you to get more information. We hope you found it useful, and we thank you, Dr. Zeiger, for your time today. And I thank you for watching Ask Us Anything About Anxiety from Penn State Health.